Hey everyone, it's Dr. Lavell, and as you can see here, I'm holding a model of spinal degeneration, also known as degenerative disc disease or spinal arthritis. All three of those are synonymous. Now, people always ask me, how does degeneration happen in a disc? Well, this process is just that. It's a process. So what happens is the disc is normally like a teeter-totter. It's made of two components. You have the center part here. That part there is called the nucleus. Now you can see it's sticking up a little bit. And then you have all these little rings, as you can see there. Hopefully you can see them. These little rings that run circular around it this way, and they also run up and down this way. And those are called annular fibers. That center part is called the nucleus. Now it's liquid, but it's pretty thick. It'd be about the thickness of ice pack gel. And the rings around it, those are real tough and strong. Those are called annular fibers. Those are like the cables that hold that disc together. So normally that disc sits in the middle and everything moves around it kind of like a teeter-totter. That's the best analogy I can give you. If you have that center point of the teeter-totter in the middle, everything's going to work great. It's going to move back and forth. When that disc misaligns, slips, bulges, herniates, biomechanically, it's all the same issue. That center part of the disc is now shifted out of place, and now you're going to get stuck. Just like a teeter-totter, you're not going to have enough leverage to pull that back. So now that disc is stuck and it's sitting out where it shouldn't be. It's bulging out there like you're seeing here, and that disc is no longer going to be able to move properly. So what will happen is that disc, because it's avascular, is what the research shows, there's no blood supply to a disc very well. It's very dependent on what's called diffusion, which is this pumping motion back and forth. And what it'll do is it'll suck in nutrition and water and get rid of the waste. Now you can see that on MRI. That's called disc desiccation. And what that looks like is that disc will get thinner and darker as we view it on MRI. And when we have that desiccated disc, that is a sure sign that the disc is not moving. That particular disc is stuck. It's not moving. And usually it's going to 99% of the time correlate to where we have a slipped, a bulge, or a herniated disc. The way I describe them, the differences in the amount of the rings that are torn. Slip discs, generally, you don't have a ring that tears. You throw your back out for a few days, you're fine. Bulging disc is where some of those rings are torn, but not all. And a ruptured or herniated disc is where they're torn all the way through. But bottom line is you're going to have a disc that's not moving. So when that disc doesn't get water and nutrition, you see that desiccation on an MRI. The second thing that happens is it's not going to be able to pump back and forth to get rid of the waste products. And in the research, those waste products have been shown to be acidic. And what will happen is they will accumulate over time. So imagine if I had a beaker of acid and I had you put your finger in there, how is that going to feel? Not good, right? There's your pain part of the disc issue. What's going to happen to the disc, or your finger rather, the longer we leave it in that acid? That's right. It's going to dissolve. It's going to burn away. Same thing happens to your disc. So what will happen is that disc will not be able to move back and forth very well, and it's going to be able to start to accumulate in waste products. First, the disc gets thinner and darker. Then it begins to break down, and now you can see it's getting acidic in there, and the disc is starting to get eaten away. And eventually, it fuses together. Now, when you're in this stage, there's probably not too much we can do for you. But when you're in these stages, we can do great, especially this one, because we can usually bring it back. When it's in this stage, we can definitely prevent it from getting worse and remove your symptoms, which is the key thing, which is what most people are looking for. So if you're wondering if spinal decompression can help a degenerative disc, absolutely. We need to stop that process that brought that from coming on. And that process is that disc not being able to move back and forth. So if we can take that disc and get it from off of this part and back to the middle, get it to work again, we're going to see a much better outcome. So that's how spinal decompression can work for degenerative disc. Hope to see you soon.